So I'm particularly interested in the arm motor system and how the brain controls that. So we're talking about really simple point-to-point reaching movements. I point to here and I get to another target. This has a lot of complex issues. We have to localize where this object is where I want to get to and figure out how we're going to move in order to get there. So we can use this as a model to understand more complex movements. In my research, usually we have people try to move a cursor that represents their hand onto different targets. So we have a target, they have to move their hand toward it to acquire that target. This involves multiple processes. They have to be able to assess where that target is, be able to figure out where that location is, and figure out the correct movement toward it. We manipulate that information. We manipulate the location of the target, we manipulate where they see their vision, the visual feedback of their hand, in order to understand how people are able to cope and adapt to these different circumstances. How quickly, how long they're able to persist in this, whether we see changes in these processes across different populations. So I'm interested in seeing how these processes change with age or in patients who suffer from disease or damage, particularly to their cerebellum, or in the case of basal ganglia, an area that's atrophied when people suffer from Parkinson's disease, because damage to the cerebellum and Parkinson's disease are associated with motor deficits, and they're very prevalent kinds of conditions in our older population. So it'd be really important to understand their contribution to motor control and motor learning. Understanding how we're able to produce movement and use vision to produce movement means we could change our environment to make it better, accessible. We can have better driving systems. We can have better systems for aging people who might have difficulties navigating in this world, in this very complex visual world, and streamline the kind of visual information they need to know when driving, when walking, when reaching, when interacting with objects in their kitchen. It'd be so valuable if we can use the information we learn now, not only to help people who might be suffering from disease, but even take people even in a normal state and make the environment easier to interact with.